Good afternoon, everyone. It's a pleasure to meet all of you today. I'm very thankful for you to invite me here in your barangay to speak. So let's start. In our modern world, our lives are becoming modernized. Our way of living, transportation, even the way we communicate to each other are way beyond different than before. Well, for example, just like when you invited me here to speak for you, you chatted me through Messenger. So even relationship and intimacy is modernized also. Modern relationship nowadays are easy to form, yet it is also easy to fall apart. With just one chat of hello, did you already eat? You form love bond to that stranger. And then you meet out the next day, you go drink, you go lunch, and then you go to the motel, and then you know what will happen. You have sexy time with that. But one day, one morning, you left all alone. That stranger you meet yesterday was all in the past already. And then you feel heartbroken. But life must go on. So the next day you meet another man and you do the same things you did to the past one, and then the cycle goes on. So in this world with modern people, with modern relationship, it is not shocking that a deadly virus will spread to destroy the future of not just you and me or any other single person in the world, but all of us, all of million lives. So here I am today to tackle to you all about HIV infection, awareness, treatment, and prevention. So here are the main points that I will share to you today to know more about this topic we will tackle about. First, how does a person get infected with HIV? Second, what are the symptoms an HIV infected might experience? Lastly, what are the treatments and prevention to heal from and avoid acquiring HIV? Well, in this generation, youngsters are wild and free. At a young age, they already experience romantic relationships. In this romantic relationship, they experience holding hands, dates, kissing, making out, and even the bliss of sex. In 2016, about 36.7 million people worldwide were living with HIV. Of those, 2.1 million were children below the age of 15. We all know that it is new normal these days, and yet this is frightening. How simple it is for people to have sexual intercourse with different men or different women every single time. How easy for them to have multiple partners and even have time to have sex with the same gender. Really, the world is so frightening these days. So it isn't shocking to know that these kind of behaviors will result into something that's really dangerous, and that is human immunodeficiency virus or HIV. Anyone can acquire HIV, may it be men, women, gay, and lesbian, of all ages and races. Well, HIV came from a virus that infects African chimpanzees. Um, and well, humans as we are all do, who are eating anything we want, that's because of consuming chimpanzee meat. Thus, it likely mutated in our body and become what we know today as HIV. The virus is transmitted in bodily fluids like blood, semen, vaginal and rectal fluids, and breast milk. In some ways, it was also spread person to person through vaginal or anal sex, sharing needles, syringes, and other items for injection drug use during pregnancy or labor, breastfeeding, and etc. And it is not true that HIV can be spread through kissing, sharing food or water with another person, and oral sex with another person. HIV is a virus spread through certain body fluids that attacks the immune system. Once contracting with the virus within 2 to 4 weeks, the person feels flu-like illnesses, include fever, chills, swollen lymph nodes, general aches and pains, skin rash, sore throat, headache, nausea, upset stomach that lasts for a few weeks. But in this stage of acute HIV infection, people are unaware that they're infected because they may not feel sick right away or not at all. It is because it is a body's natural response to infection. The second stage is the clinical latency, where HIV is still active but reproduces at low level. People may or may not get sick or have symptoms at this time. The non-specific symptoms include headaches and other aches and pains, swollen lymph nodes, recurrent fevers, night sweats, fatigue, nausea, vomiting, diarrhea, weight loss, skin rashes, recurrent oral or vaginal yeast infections, pneumonia, and shingles. If these are not treated immediately, HIV might progress into more severe stage, which is AIDS. AIDS is the most severe phase of HIV infection. People with AIDS have such badly damaged immune systems that they get an increasing number of severe illnesses called opportunistic illnesses. Without treatment, people with AIDS typically survive about 3 years. Only 3 years. That's so little. Common symptoms of AIDS include chills, fever, sweats, swollen lymph glands, weakness, and weight loss. People with AIDS can have high viral load and can be very infectious. So, treatment should begin as soon as possible after a diagnosis of HIV. So you must get treated after you know that you have an HIV, regardless of viral load. The main treatment for HIV is antiretroviral therapy, a combination of daily medications that stop the virus from reproducing. Antiretroviral therapy helps keep HIV from progressing to AIDS. It also helps reduce the risk of transmitting HIV to others. So, if you get treated immediately, you will save others from getting sick also. When treatment is effective, the viral load will be undetectable. The person still has HIV, but the virus is not visible in test results. However, the virus is still in the body. And if that person stops taking antiretroviral therapy, the viral load will increase again. Sadly, right now, HIV still has no cure or vaccine to prevent it. But there are always ways to stop spreading or prevent it from spreading or contracting HIV, like safer sex. First, you and your partner should get tested for HIV and other sexually transmitted infections. Make sure to use condoms, not just to prevent HIV, but also to prevent getting pregnant or impregnated someone. And most of all, be contented to one. In short, be loyal. Limit your sexual partners. And also, avoid sharing needles or other drug paraphernalia. To let it clear, don't use drugs, children. And lastly, if you already have HIV, and take your medications regularly and consider PEP and PrEP to reduce the risk of contracting HIV. So as I close my speech, I want you to be reminded that the world today may be new and modernized world because of technology. Yet it is dangerous. It is becoming more dangerous. We meet different people on a daily basis, not just personally, but also electronically. We chat, then the next day we make out, without knowing that in just a blink of we already have contracted the virus, that until now it is incurable. Death may such be a long destination, or just a short one, but still, it is painful for sure. And it is just because of being reckless, wild, and free of us people in the world. So before I finally close my speech, there are some questions that needed to be answered. So let's start with the first one. How do I know if me and my partner have HIV? Well, the only way to know for sure whether you have HIV is to get tested. Knowing your status is important because it helps you make healthy decisions to prevent getting or transmitting HIV. So, for those who have partners or planning to have partners, you should get tested first, you and your partner. Always remember that. Next question. What is the life expectancy of a person with HIV? Well, in 2011, a 20-year-old person with HIV can expect to live another 53 years if started with early proper treatment. But when HIV advances to AIDS, life expectancy without treatment is about 3 years. So you need to get treated immediately if you already know that you have HIV, so that you can still live a normal lifespan, because nowadays people die early, so 53 years is just a normal lifespan of people. Lastly, the last question is how to help people living with HIV. This question is very important right now because people are so afraid to get in touch with HIV infected person. So we must help each other. We must help those who are infected with HIV because they are not very scary at all. If you just help them, they can live a normal life. First and foremost, make their health a top priority. Make sure that they always eat balanced diet and healthy food and monitor their health. Let them avoid vices like smoking, using drugs, because it will create more complications in their health. You must also focus on their emotional health because these people with HIV are so very emotional because they feel like they already destroyed their life and they lost all hope in living already. Like their future is something that is vivid to their minds already. So show them love, surround them with love and care, and always support them. Never let them alone. Always be by their side. And if you are or his partner, use safer sex practice like using condoms and talk to a healthcare provider about PrEP and PEP. Last but never the least, tell them to have faith in God. Always pray and don't give up. Remember that. So, if you want to live a healthy and normal life, then start to live a healthy lifestyle. All of you are still young and full of dreams. You may be free, but it is not a reason to be wild and create mistakes that might destroy your life forever. It is okay to love others, have fun, but first, learn to love yourselves. And always take care of yourself. Remember, an ounce of prevention is better than a pound of cure. That's all for today, and thank you for listening. Thank you, everyone.